This skill is the 4-pillow side lying position skill, and there are no supplies to bring into the room. So I'm going to start by knocking, getting permission to enter. Can I come in? She says yes. I'm going to introduce myself and make sure that I have the proper resident. And before I do anything, I'm going to sanitize until dry and pull the curtain for privacy. I'm going to confirm that the brake is on, and I'm going to raise the bed for good body mechanics for myself. And that looks good. As I talk with the resident about the plan to change her position, which she's in agreement to, I'm going to invite the test observer to come in for safety because I'm going to be moving the resident to the side of the bed. She's in a supine position right now, and so I would never expose my resident, but for demonstration purposes, I'm going to show you what I'm doing. So the test observer is here for safety. I'm going to bring the resident towards me with 3 maneuvers. I'm going to put my hands under her back, and I'm going to move you towards me, explaining to the resident what's going on. And then I'm going to do the hips, and then I'm going to do the lower legs. At this point, I'm going to cross the ankles to help her turn in the position towards the test observer. And I'm going to help her by counting and cueing 1, 2, and 3. And I'm going to start with the first pillow behind the back. And then I'm going to invite her to lean back against the pillow to comfort. The next pillow I'm going to place between her legs with the underneath leg slightly bent. And I'm going to offer support to the upper leg as we have a little bit more of a bend in the top leg. And we want to make sure her hips are in a good position. Let's see if we can't get her. At this point, I'm going to switch to the other side, and the test observer is going to go to the other side of the bed. I actually want the 3rd pillow with me so that I can put it under her upper arm. And I'm going to place the pillow so that the arm is slightly bent and there is some air at the armpits and her hand is comfortably resting on the pillow. At this point, I also need to move the pillow under her head. That would be the 4th pillow. So I'm going to offer support to the head and move the pillow into position. At this point, I'm going to look at the position of her shoulder that she's laying on. I'm going to cup my hands and put my hands underneath to bring her shoulder out a little bit. And because I'm changing her body a little bit, I'm going to look at all of my pillows, and if I need to reposition it all, this is when I can do it. So I'm making sure that I've touched the head pillow, that I have repositioned the pillow under her arm, her leg with the top one bent more. I'm going to return the sheet for privacy and double check that she has enough support from the pillow at the back. At this point, I'm going to ask for her preference on where the call light goes, and she says in her right hand. So I'm going to put the call light in her hand, cover her for privacy. I'm going to lower the bed so the bed is confirmed to be locked low with call light in position. And I'm going to take care of any of her needs before I leave the room. At first, I'm going to take care of the privacy curtain, sanitize my hands until dry. I'm going to assess that all the pillows are in proper position and say I'm done.